The time when you're applying to residency is one of the most emotionally charged times in your life. It's a difficult moment in your life. You have to understand that neurology is not a job. It is who you become. It is not just something as a paycheck. I'm Marwan Sabbagh. I am Professor of Neurology and Vice Chair of Research at Barrow Neurological Institute. Barrow Neurological Institute is a nonprofit research entity and clinical care entity for over 60 years. Famous in neurology, famous in neurosurgery. It is destination healthcare with excellence in neurology and excellence in neurosurgery. Cutting edge things happen here every single day. Breakthroughs happen here every single day. When you're looking at a residency, you need to think about, am I going to be well trained? Have I seen everything I need to see as a neurologist? Am I going to be supported? Is the culture of the environment such that I know I'm not going to be left on my own? I will always be trained, I'll be educated along the way, didactic lectures, etc., so that you can feel like you are learning with other people along the way to become well trained. And then the third part is look at the research, and because the research tells you if you're reading about it in Journal Club or you are the person doing the study to begin with. We at the Barrow Neurological Institute are the place where the cutting edge stuff is occurring. We are the place that you're going to learn first about a lot of developments, and we are the ones doing the research to begin with. Not a lot of other people can say that. Not a lot of centers can say that. Most residency programs just focus on the residents seeing the patients and getting some lectures, and they really kind of consider research to be an afterthought. We're trying to say it's part of our DNA. We want people to be curious. We want to give them the infrastructure and support to see those ideas through. And so what sets us apart is that there'll be more opportunities than other places to do research and more variety of opportunities to do research than other places. We're creating a research curriculum so that people will be familiar with research of all kinds. We're also creating the infrastructure to support it. A lot of people know what they want to do, they just don't know how to do it. So we're creating a faculty mentorship program. We're creating statistical support to have students and residents be able to do the project that they have in mind. And we're going to reduce any institutional barriers to achieve it. Most of the research opportunities that Barrow Neurological Institute residents have been involved in are mostly around case series, data collection based on what they're seeing in rounds. But we want to go well beyond that. We want to give them opportunities to learn how to do a clinical research, clinical trials. We want to teach them how to do data inquiry. What I'm trying to say is that we're going to diversify the opportunities and let residents pick how they want to go about doing it. One of the things I'm very excited about is the opening of our new data center. This will give us access to millions of Medicare patient lives and the data associated with them to be able to look at statistical associations of neurological diseases and other health conditions. This is unique and very coveted. You'll have more opportunities and more diverse opportunities for research than other places can offer. Most residents go on to do fellowships, and fellowships always ask, what did you do for research? And they want to know what you're doing, and they're interested when they hear about your research projects. So we want to have an abundance of research opportunities for our residents of all kinds. If you are interested in research, we will give you multiple opportunities and multiple ways to support your curiosity and your infrastructure. However, if that's not for you and you just want to focus on patient care, we will not be nagging you. I'm not going to beat you over the head and say you need to do research. This is a place that wants you to be best in your craft at whatever that is. If it's just clinical care, we will support that. But if it's going to be clinical research, clinical care, and personal research, we have the ways to do that, and this is the place to be. You want to think not just at the moment of the next 3 to 4 years of your training and your life. You need to think beyond that. You need to think about what your future 5 and 10-year plan looks like. If you are committed to clinical care, and that's the path you want to take, Barrow Neurological Institute is going to support you and make you the best clinician you can be. If you're saying, I am a research-oriented person, and you want to become a physician scientist, again, Barrow Neurological Institute will be a place to help you develop your craft and research directives, so you can't lose by coming here.